guys, it's Brittany here from My Core Floor, and I am back for part 3 in our pelvic floor video series on Facebook Live, leading up to Sunday night's big webinar. So if you are not registered yet, I will put the link below after I'm done chatting, and you can go ahead and register. It's going to be Sunday night at 7 p.m. Eastern Time, and we are going to talk all things pelvic floor. We talked last week in the Facebook Live about what the pelvic floor is. We talked Tuesday about incontinence and prolapse, and we are talking tonight about pelvic pain. And in Sunday's webinar, we're going to kind of put it all together. We're going to give you guys some tools for self-assessment. We're going to give you guys a little workout program. So my 3-ish favorite pelvic floor exercises. It might actually be 3 exercises with some parts A and B. So Sunday night, you do not want to miss the webinar, because we're going to kind of tie all these Facebook Lives together and give you guys some tools to start finding some success in your pelvic health. So without any further ado, we are going to start talking tonight pelvic pain. And I love talking about pelvic pain because it's a little bit of a tough topic, and I find more and more in my practice that there are a lot of women that are suffering silently with pelvic pain issues that they've never talked about, they've never told anybody, for a wide variety of reasons. So I want to kick off tonight's talk first by telling you guys that pain is not normal. Pain is there for a reason. It's letting you know that your body is going through something it shouldn't be going through. And so it's really important when we're talking about pelvic pain or really any kind of pain to make sure that you don't just ignore it, that you don't just push it aside and kind of pretend it's not there or hope it goes away, because your body is letting you know that that pain is there for a reason. And so the first thing I want to let you guys know is that related to pelvic floor issues, if you are experiencing any sort of pelvic pain, so that really can encompass a million things, literally. So if you're having pain with sex, if you have pain when you go to the gynecologist, if you're having menstrual pain, hip pain, low back pain can sometimes be related to pelvic floor dysfunction. Guys, it's not normal, and you need to let somebody know, whether that's you reach out to a pelvic PT, meaning that I am perfectly welcome to have people chat to me, reach out to me privately to talk or see if I can give you some direction on where to head. But it's really important to talk to somebody, your doctor, gynecologist, urologist, PCP or primary doctor, whoever it is, somebody you trust. It's really important to address pelvic pain. So that's kind of the first thing starting off tonight, is that pelvic pain is not normal. The number of women that I see coming in, and a lot of times they'll come in for bladder issues because maybe they've heard about pelvic PT because of bladder stuff, and I always ask about pain issues because I find that women don't often voluntarily let me know that they've had pain or that they're having pain. And I find a number of women that just think that that pain is normal, which always just is mind-blowing to me. I had a woman the other day I've been seeing for a few one-on-one sessions, and she said to me, when we're done working with my bladder, is there something we can do for the pain that I have with sex? Like, as long as I can remember, sex has never been enjoyable. And I was like, you're 30 years old. Like, that's not okay. And she was like, well, it just has always been the way it is. So I just thought that was normal, or that was my normal. I had a woman who I worked with in a group class setting who talked to me after class one day that she was in her late 40s and her husband had not had sex for, she said, a couple of years, but when I finally met with the two of them together, it had actually been closer to 7 or 8 years that they had not been able to be intimate because of her pelvic pain. And she literally said to me these words, I thought it was my lot in life. I just thought that that was just how my body was, that I had reached a point, I've had kids, I'm starting to hit, perimenopause, that was just my lot in life. I will tell you, ladies, it is no one's lot in life to suffer in pain. Sex is supposed to be enjoyable, whether you're 18, 25, 35, 65, 75. There's not an age where it becomes okay to be suffering in pain, and you certainly don't deserve to be suffering silently. So in talking about pelvic pain tonight, what are we talking about? Like, what is pelvic pain? Well, it really it's such a wide diagnosis that encompasses so many things. So pelvic pain, guys, can be pain with sex. It can be pain when you go to the gynecologist. And certainly no one loves going to the gynecologist. No one loves a pap smear. But it's pain beyond just the normal, like, yeah, there's some pressure here, or a little bit of discomfort that kind of goes away. This is pain that really is sharp. It's intense. It's burning. Really excruciating. That's not normal, guys. So I need you to know that. So it can be pain with sex, pain with gynecological exams. Sometimes, guys, hip pain and low back pain can actually be coming from the pelvic floor. So if we go back to the model again, we showed you guys the other night how closely related all of these things are intertwined. So your pelvic floor attaches to the spine. It attaches up in the front of the pubic bone. It's overlapped by the hip muscles. And so sometimes that pelvic floor, when it's not functioning well, can actually start causing those other areas to dysfunction as well. And so I've had a number of clients I've seen one-on-one that started out with some of my coworkers and then were transferred over to my schedule because they weren't responding to the usual back and hip treatments. So if you're someone who's had long-standing hip and back pain that doesn't seem to be responding to the typical exercises, physical therapy, injections, you might want to look into pelvic PT or into doing some of the pelvic work we do through My Core Floor or through the free group, because sometimes those pelvic floor muscles, when they're dysfunctional, can actually cause hip pain and low back pain. I've seen a number of women who've come to see me also for abdominal issues, things they thought were related maybe to IBS or to irritable, some other irritable bowel, constipation type of issues, digestive problems that we have actually found were pelvic floor related. I had one woman that had this chronic low abdominal pain. She was in her late 20s, so she was fairly young. She had already had a colonoscopy, a wide variety of tests, and when we did her pelvic floor assessment, her forward part of her pelvic floor, that anterior part that attaches near the pubic bone, was so in spasm that it was actually giving her abdominal pain that was disguised and being misdiagnosed as other things. So your pelvic floor can actually spasm and also refer pain to these other areas. So it's really important to know that if you're someone who has been suffering with long-standing abdominal digestive issues, back, hip issues, groin issues, that actually can be pelvic floor related. And so pelvic pain doesn't have to just be vaginal pain. It can really be anything in that whole pelvic ring that is not working well. So what are symptoms? Certainly we just talked. Back pain and hip pain can be symptoms of pelvic floor dysfunction. Abdominal pain, menstrual type cramping, lower abdominal cramping can be signs of pelvic floor dysfunction or pelvic floor spasm. Burning kind of pain, sharp, intense pain. Those are all things that can be related to pelvic floor spasm and pelvic floor dysfunction. Guys, you don't have a low pain tolerance in most cases. I've had a number of women that experience pelvic pain that will come in and tell me that they have been told they just have a low pain tolerance. Or their partners have said, well, just have a glass of wine before we have sex and that'll just relax you. You're just not relaxed. Guys, pelvic floor dysfunction goes far beyond just needing a glass of wine to relax, okay? It goes beyond just pushing through and hoping it gets better, or making sure, the number of clients I've had tell me that they keep the lights out during sex so that their partner can't see the pain on their face. That's not okay, guys. That's not normal. That's not what you should be living with. Sex should be enjoyable. It's meant to be enjoyable. It's not your lot in life to be suffering. And if you're someone whose sex has always been painful, then you should see a pelvic PT. I have a girl I've been working with for a little while with the My Core Floor exercises. I've gotten her on a dilator program because there's things you can actually do with dilators and wands to release the pelvic muscles. And she has worked really hard to get to a point where she is actually starting to have sex again. And literally, this woman is in her late 20s, early 30s, and sex has never been comfortable. And she has struggled with her partner to even be able to have him enter her, never mind have enjoyable sex. So, guys, it's really, really important to understand what's normal and what's not normal, but also to understand that this pain can be addressed and there's things you can do. Increasing blood flow into those pelvic muscles can help to relax the tissues to help improve a lot of those pain symptoms. Now, the other thing in addition to pain kind of related to sex and gynecological exams and those things, there's also pain related to things like endometriosis or adenomyosis, which are related to hormones and endometrial tissue that starts to grow in areas it doesn't belong. So adenomyosis, endometrial tissue starts to actually grow into the uterine wall. And guess what, guys? Because your pelvic floor is supporting those organs, when that endometrial tissue starts to inflame, and a lot of times with your monthly cycle, it can inflame at different points, it can actually cause your pelvic floor to spasm. So I have a number of women that I have worked with also that have found success with pelvic floor PT and pelvic floor exercises who suffer with these types of diagnoses, because increasing the blood flow helps to relax the tissues and helps them to better manage some of those symptoms. Exercise does not take away adenomyosis. It doesn't take away endometriosis, but it does help you to manage the symptoms. The other thing I've seen is I have a girl right now I've worked with that has endometriosis. She's going to be having surgery, but she has had severe abdominal pain with periods. She's had this chronic hip pain that she can't resolve. And we've been doing pelvic floor work with her. We have her doing self pelvic floor work. We have her doing exercises, and she is finding relief in ways that she can actually manage her symptoms. So it's really important to understand that pelvic pain isn't just, you can't have pain-free sex. It's not just the gynecologist hurts. It goes into endometriosis, adenomyosis, abdominal pain, IBS, constipation. There's so many factors, guys, that can influence that entire area that your pelvic floor plays a role in. And sometimes releasing those pelvic floor muscles and getting the right exercises to increase blood flow into that area can actually help to relax the tissues and help you to manage those symptoms better. So again, pain isn't normal, okay? Exercise can help, pelvic PT can help, dilator work can help, using a wand. And I can actually, in the comments below, show a link to the kind of wand that I usually recommend people to get. And I don't recommend you using it without proper technique or training, with a pelvic PT preferably, because sometimes the instructions that come with those things, I'm always like, what in the world? So I do recommend, if you're going to look into getting a wand and doing some self-release because you suffer with pelvic pain, to certainly either reach out to me or consult with a pelvic PT in your area so that you know how to kind of manage it and how to do it properly so that you don't cause more pain or more harm. The other big thing I'd like to talk about when we're talking about pelvic pain, guys, beyond just symptoms and what it encompasses and, you know, what types of things can contribute to pelvic pain, is the fact that pelvic pain goes far beyond the physical. And so making sure you guys understand that there is a huge emotional component to managing pelvic pain, because when your intimacy has been affected, when your relationships are affected, when your ability to maybe get pregnant and get affected because having sex is so painful, when going to the gynecologist becomes something that you are constantly rescheduling because you're trying to just put it off, when you're dealing with chronic constipation or abdominal pain that limits your ability to go out to eat with friends or to be out in public because you're just in such discomfort, when endometriosis limits your ability to do the things you love to do, whether that's run or dance or just be out, again, enjoying yourself recreationally, it takes a toll on you mentally and emotionally. So understanding, guys, that pelvic pain and healing pelvic pain goes far beyond like, here, do a few exercises. Here's a wand that helps to relax the tissues. It also goes into understanding that you have to talk about it. You need to get it out. I spend a lot of time talking with my clients, and even in the group sessions, I'm constantly talking and giving tips and letting people know that it's a space where they feel safe, that they can talk about these problems. Because if you hold it in, your body is going to reflect that. And so just like anything, when you feel stressed and you feel like, oh, my neck is so tight, or you feel like your upper traps are kind of in your ears, your pelvic floor will respond to that emotional stress as well. And so understanding that healing your body also means healing your mind. So doing things that mean, maybe it's doing some meditation, maybe it's doing EFT or tapping to help manage pain, maybe it's doing other things that maybe are just mind, body, spirit related, whether it is going to church, taking a walk, seeing a counselor, talking with your pelvic PT. It's really important to make sure you're also addressing the mental and emotional side of pelvic pain, because it has a huge toll. It's also really important to make sure, if you're someone suffering with pelvic pain, that you're also talking to your partner. You want to make sure that they're kind of in on this, because they don't want to know that you have the lights turned off, because you don't want them to see the grimaces on your face. So really including them in your treatment and in your conversations is really important. I always encourage, when I'm working with women one-on-one, if they're suffering with pelvic pain, to invite their partner, their husband, their wife, whoever it is, to come into treatment so that I can show them what this model looks like, so I can explain the muscle spasm. The number of women that also tell me their partner sometimes thinks it's them, that they don't want to, they're not attracted to them, or that if they were with somebody different, it would, the muscles would be more relaxed. Your partner needs to understand that this is not about them, that this is about you, and it's about your body, and it's about your journey back to better pelvic health. And so I always like to address that. Pelvic PT is not the end-all be-all. My core floor, the exercises, is not the end-all be-all to dealing with pelvic pain symptoms. It's a huge factor, and it can really help you to better manage and to understand how to manage. But you also need to make sure that you're managing the mental and the emotional side of things, and that you have a support system so that you're including your partner in on these conversations and in on what's going on with your body. Don't hide it from them, because they can really be a huge asset in improving your pelvic pain. I've taught a number of partners how to do soft tissue, or how to do soft tissue massage on their partner. So I often call it productive foreplay. I actually will teach partners how to do soft tissue muscle release on their partner to make sex easier, to make entry into sex easier. I've taught partners how to do abdominal massage to help with constipation, how to do stretching with their partners to, relax the pelvic tissues, to improve the range of motion. There are a number of ways we can include your partner in. And so I just also want you to be aware of that. This is not something you need to battle alone, and it's also not something you should battle alone, because it's exhausting. Chronic pain is exhausting. And a lot of times the women I see have usually seen a number of practitioners that have misdiagnosed them before they get to me or before they get to a pelvic PT that can actually really help them and help them on that journey. And so they're frustrated and they're tired and they just feel like there is no answers for them. And so I want you guys to know that there are answers, and there are people that want to help you, and that your partners want to help, and we can include them in the treatment options. And so I want you guys to be made aware of that, because the number of women, like I said, that suffer silently and just think that this is their lot in life, or this is how their body was made, it blows my mind. When you look at statistics, guys, when I look at research, it says 1 in 3 women will suffer with some form of pelvic pain at some point in their life. Again, that's a pretty high statistic. We're back to looking at the same numbers as the number of women that experience incontinence issues. 1 in 3. So if you look around your friend group the next time you guys are all together, 1 in 3 of you is suffering silently with pelvic pain. Talk about it. Ask them. It's not normal, and it's good to start the conversation, because once you start the conversation, you open it up for somebody else to also have that conversation and feel a little more comfortable. One last thing I will talk about related to pelvic pain, that's also just another little tidbit that people often don't know, is if you are someone that suffers with pelvic pain with like gynecological exams, make sure you ask your practitioner about using a pediatric speculum. I have a number of women that I also talk with that don't realize that there is even an option for speculums, is also amazing. And I sometimes feel like our doctors just get into a flow of, doing their job, that they don't always think to ask or think to bring it up. And sometimes they don't have the pediatric speculums in their office. So if you call ahead to make your gynecological appointment and you're someone that has dealt with chronic pelvic pain or painful gynecological exams that it's sharp and burning and you leave there with pain for hours or days afterwards, ask your gynecologist about a pediatric speculum, because it's much smaller and it still allows them to do your pap smear and your checkup and everything they need to do, but a lot of times with a little bit less pain and a little bit less discomfort. So just another little tidbit that you can just kind of know if you're someone that's been battling pelvic pain issues. So that's it for tonight on pelvic pain. Again, we're going to chat a little more on Sunday night when we get into it and talk about some ways that I like to manage pelvic pain with my patients in terms of soft tissue work, in terms of exercise. But I wanted to just get you guys into kind of the mode of mind, thinking of pelvic pain, realizing that it's not normal to suffer with this kind of discomfort, especially chronically, that pelvic PTs are here to help you, whether it's me or a pelvic PT wherever you live. Talk with somebody, talk with your partner, and make sure you're taking care of you. If you're someone that's dealing with pelvic pain, whether it's endometriosis, adenomyosis, pain with sex, pain with gynecological exams, constipation, chronic IBS, any of those things, make sure you're also doing the work for you to deal with this, because I know how exhausting it is and how difficult dealing with pelvic pain is. So just make sure you're also taking care of you and that you're reaching out and not suffering through it alone. That's probably my biggest recommendation to all women who are dealing with pelvic pain, is don't do this alone. You don't have to. There's people out there. I want to help you. If it's, you're not sure who to reach out to, private message me, comment below, shoot me an email at brittany@mycorefloor.com and we can chat more. That's it for tonight. I hope you guys, if you have any questions, you can always reach out, comment below if you're watching this on replay. Join us Sunday night. I'll put the webinar link below as well, so that you can come and hang out with us, learn some self-assessment, learn a little bit more about managing pelvic pain, through exercise, through movement, and through some soft tissue work and self-assessment. Have an awesome rest of your night, guys, and we'll talk soon. Take care.